Today, I have picked anemia as our topic because it's a common condition that I see in day-to-day practice. It is notable that most of my patients are confused and anxious about the implications of this diagnosis and what to expect next. I hope this video equips you with the knowledge to navigate uncertainty more confidently. Here is Professor Eamon Murphy to take us forward.
Hello everyone! Today, we're diving into a topic that affects millions worldwide. Anemia. We will cover the basics of red blood cells and hemoglobin, look at common causes of anemia, and discuss prevention and treatment options. In order to answer this, let's take a closer look at our red blood cells. Red blood cells are loaded with an iron-rich protein called hemoglobin. Hemoglobin binds oxygen from the lungs and distributes oxygen throughout the body via blood vessels. Whilst doing this, they collect carbon dioxide and other waste materials from the cells and transport them back to the lungs, kidney, and liver for excretion. Anemia occurs when there aren't enough functioning red blood cells or too little useful hemoglobin in the bloodstream. This limits oxygen transport to our tissues, and without oxygen, the body can't survive. To understand how anemia occurs, we need to know the life cycle of the red blood cell. Red blood cells are formed in the bone marrow. Proper formation requires specific conditions to be fulfilled. Firstly, it requires a healthy bone marrow. If the bone marrow is unhealthy due to conditions like leukemia, myelodysplastic syndromes, chemotherapy, and radiation, it will produce abnormal blood cells. This condition is called dysplastic anemia. Toxins, viruses, certain medications, and autoimmune diseases can stop the bone marrow from producing enough blood cells. We call this aplastic anemia. This can affect all blood cell types, not just red blood cells, resulting in a condition called Pancytopenia. The bone marrow requires signals from certain chemicals, like erythropoietin and cytokines, to stimulate red blood cell production. These chemicals are adversely affected by chronic conditions like kidney disease, cancer, or autoimmune diseases. This causes reduced red blood cells, leading to a condition called anemia of chronic disease. To produce normal red blood cells, the bone marrow requires raw materials like proteins, iron, vitamin B12, and folic acid. Malnutrition and diseases affecting nutrient absorption, like celiac disease and inflammatory bowel disease, can lead to iron or vitamin deficiency, anemia, or a combination of both. If our genes are faulty, none of these matter. Genetic disorders like sickle cell anemia and thalassaemia will produce both abnormal red blood cells and hemoglobin, compromising oxygen-carrying capacity with resultant anemia. Red blood cells start out as reticulocytes. They have a lifespan of 120 days. At the end of their lifespan, they are broken down into their components in the liver and spleen. Premature destruction of red blood cells occurs in hemolytic anemia, caused by a variety of conditions like autoimmune disease, deficiency of G6PD enzyme, malaria, and certain medications. Blood loss is a frequent cause of iron deficiency anemia, often resulting from heavy menstrual bleeding, gastrointestinal bleeding, or bleeding from the urinary tract. The diagnosis of anemia is based on hemoglobin levels. Normal hemoglobin levels vary by age, sex, and pregnancy status, and fall within a defined range. Levels below this range indicate anemia. While hemoglobin is key to diagnosing anemia, other red blood cell parameters provide valuable insight. Hematocrit measures the percentage of the blood volume occupied by red blood cells. It decreases in anemia due to a lower concentration of red blood cells. Mean corpuscular volume, MCV, reflects the average size of red blood cells. A low MCV, known as microcytosis, occurs in iron deficiency anemia, where cells are smaller than normal. Conversely, a high MCV called macrocytosis is seen in vitamin B12 and folic acid deficiency, where cells are larger than usual. Mean corpuscular hemoglobin, MCH, measures the average amount of hemoglobin in each red blood cell. In iron deficiency, MCH levels decrease, causing the red blood cells to appear paler than normal, a condition known as hypochromia. Another key diagnostic feature is the shape of red blood cells under a microscope. If more than 10% of the cells are abnormally shaped, it's called poikilocytosis, with the specific shapes varying by condition. For instance, sickle-shaped cells are characteristic of sickle cell anemia. In cases of hemolytic anemia, or blood loss, there is often an increase in immature red blood cells, or reticulocytes. This reflects the bone marrow ramping up red blood cell production to compensate for the excessive destruction or loss of mature cells.
Thank you, Professor, for sharing your absolutely fabulous talk with us. Now let's dive into the clinical aspects of anemia. Let's meet our patient, Donna.
Doctor, I have been feeling really breathless and tired. I have a bad headache for the past 4 months. My work have told me that I am being unusually forgetful lately. I can't stop my legs from moving. Sometimes I feel faint and weak. My periods are really heavy and painful, and it's getting very difficult to cope with work. Can you help me?
Donna is describing typical symptoms of anemia. Our next step is to uncover the cause of her symptoms, and to do that, I will be turning to my alter ego, Mr. Sheldon Homewood.
You know my methods. It is time to question Donna and eliminate the impossible. Whatever remains, however improbable, must be the truth. I shall delve into her diet, her medications, and her personal and family history of illness. I shall inquire about weight loss surgery, past or recent blood loss, and the details of her menstrual history and pregnancies. Of course, any red flag symptoms must be considered. Lastly, her social history, including smoking, alcohol use, and recent travels, shall not escape my keen attention. Every clue shall bring us closer to the answer.
What would I do without Sheldon? Onwards and upwards. Let's dive into what I will look for during the examination. I would look for a fast pulse, low blood pressure, and weight loss that indicates poor nutrition. There may be signs of blood in the urine. Pale, dry skin and hair thinning may be a feature. A smooth tongue, also called atrophic glossitis, is a common finding. Angular cheilitis or cracking of corners of the mouth and spoon-shaped fingernails or coeliac are other signs. Heart problems such as heart failure may occur. I'll keep it simple and do the following initial tests when anemia is suspected. Serum ferritin is the go-to test for iron stores, with levels below the normal range confirming iron deficiency. Except in the later stages of pregnancy, where levels naturally drop due to increased blood volume. This is called hemodilution. Ferritin can rise with inflammation, cancer, or liver disease, which complicates things. If inflammation might be skewing results, we can check other markers like CRP or total iron binding capacity to get a clearer picture. Further tests like vitamin B12, folic acid levels, blood film, reticulocyte count, kidney and liver function tests may be required. I will also carry out a celiac screen and a few pertinent cancer screening tests. Please note that this list is not exhaustive.
It's very important to find out why you have anemia and treat the underlying cause. If you're diagnosed with iron deficiency anemia, you will need iron supplements, available in different preparations and tablets or liquid forms. Current guidance is 1 tablet daily or every other day on an empty stomach. Evidence suggests this improves absorption and reduces side effects in comparison with higher doses that were commonly prescribed in the past. They may cause some side effects for some people. For those who can't tolerate oral iron, options include alternate day dosing or iron by infusion. Doctors will run tests to identify the root cause, whether it's a lack of nutrients, an illness affecting blood production, or ongoing blood loss. Treating anemia properly means fixing what's causing it, so your body can make and maintain healthy red blood cells. If you're feeling tired, weak, or dizzy, don't ignore it. Getting the right treatment can help you feel better and stay healthy.
I would refer you to the hospital if these red flags are present. Anemia can send warning signals that shouldn't be ignored. Severe fatigue or breathlessness, even at rest, and a racing heart may hint at heart strain. Dizziness, fainting, or a pale complexion with a rapid pulse and low blood pressure could signal shock. Watch for unexplained weight loss, night sweats, or unusual bleeding like black stools or blood in urine. Yellowing of the skin or eyes, known as jaundice, is another concern. If symptoms worsen despite treatment, or you experience numbness, tingling, or confusion, it's crucial to act quickly. With that, we conclude this edition of Dr. Sam's Surgery. I hope you found this video informative and enjoyable. I would like to thank our wonderful team of guest speakers for their contributions. Thanks for watching, stay healthy and take care.